everyone who thought I couldn't do it, for everyone who thought I shouldn't do it, for everyone who said it's impossible, see you at the finish line. This is a quote on a physical therapy room wall of Christopher Reeve after he was paralyzed from the neck down in a horse riding accident. I want to work with patients that are this dedicated and this determined to make themselves better. I've been wanting to be a physical therapist for about 3 years now, so I knew I really wanted to take this course because I knew it would give me the experience that I needed in order to determine if physical therapy was really the course that I wanted to pursue. The process of getting a mentor took a while, so I was just waiting around. I was really anxious to start, but once they finally found me a mentor, Miss Jenna Zeringue, who cannot be here today, we were supposed to meet for a brief 20-minute or so interview, just basically briefing us both on what needed to be done out of the project, what I needed from her, what I needed to do. And we ended up staying and talking for about an hour and a half. So Ms. Amian was very accommodating and very helpful throughout the entire process. So after talking to her, I came up with this title for my project. And it's a case study of patients' independence before and after a total knee replacement surgery. Physical therapy is a medical specialty that is used to strengthen muscles and add flexibility to a part of the body that was in some way damaged. Therapy is usually executed about 2 to 3 times daily. There are several different types of therapy. There's inpatient therapy, there's inpatient acute therapy, inpatient rehabilitation therapy, among others. Inpatient rehabilitation therapy is when a patient is able to tolerate at least 3 hours of therapy a day, while inpatient acute therapy is when those patients aren't able to tolerate the 3 hours that they need. Exercises depend on the physical therapist and what they feel that the patient needs and what kind of condition the patient is in. They also ask questions, many preliminary questions to basically understand how the patient lives. If the patient lives in a 1 or 2 story house or apartment, or if they use walking aids such as canes or walkers or anything like that, or if they live at home alone or with someone else. Total knee replacements are among the most common surgeries in the United States. They're used to correct instability in the knee. Therapy is essential to minimize disability after the surgery. Though these total knee replacements provide long-term effects, they result in severe pain immediately following the surgery. So it's difficult. The pain is difficult to control with oral or IV medications. So what doctors typically do is insert a femoral line or a femoral nerve block, and this is a tube that goes into your femoral artery, and they inject the anesthetic, and it blocks out a lot of the pain. But it can also impede movement that's required for therapy, so they normally take it out around day 3. But the physical therapist still do as much as they can while the block is in, and then do more as they can. After my research, I came up with this thesis statement. If a patient is independent before total knee replacement surgery, then they will recover more quickly than a patient who was not independent before surgery. My internship experience was wonderful. My mentor, she did acute therapy, which basically went around to different rooms and worked with different patients. Most of the time we'd walk up and down the hall with patients. Some patients were attached to like oxygen and heart monitors, so they couldn't go more than, say, 5 feet away from their bed. So, my mentor would have them just walk in place or walk as far as they could to the side and back and front and forward. If the patient needed to, they would walk up and down the stairs. Though I worked with though my project was on total knee replacements, I didn't see just total knee replacement patients. We also saw others that had different types of surgery, or they had a stroke or an LVAD, which is basically a machine that they hook up to your body, and if your heart isn't strong enough, then it'll help pump blood for you. My mentor didn't exactly like working with these patients because it was so easy for something to go wrong. You press the button or flip a switch and it could flatline immediately. My experience is something that I will cherish forever. Though I worked in the hospital, I don't think that a hospital setting is right for me. I'd rather work in outpatient rehabilitation therapy in a clinical setting, because I think that's more suited to my personality. And more specifically, I'd like to work with athletes who had suffered from sports-related injuries. But this experience, the internship, I would definitely recommend to anyone who is interested in physical therapy, because it'll pinpoint where you want to work and if you actually want to do it or not. Working in a business-like environment was very hard for me at first, because normally with adults I'm very casual towards them, and we normally have but also working with new people, my shyness came into effect, because I'm not a person that's willing to open up and be talkative around a new person that I don't know. So it took me a while to get to know these people, and I didn't only work with my mentor throughout the process. I also worked with other physical therapists at Ochsner in case my mentor was busy and couldn't work with me, or she didn't have anything interesting for us to do that day. So I did a case study on the independence of patients. I chose 2 patients. One patient was independent before surgery, and one patient was not independent before surgery. So this is a chart comparing the patient's initial evaluations right as they started therapy. As you can see, patient 1 was he was not independent prior to surgery, while patient 2 was independent. Patient 1 was independent prior to surgery, meaning that he didn't use any kind of aids, such as walkers or canes, before the surgery. And patient 2 was not independent, meaning that he did use some kind of walker or cane. Patient 1 was a 65-year-old male, while patient 2 was an 82-year-old female. As you can see, patient 2 had a much larger medical history than patient 1, and that might have led to her slower recovery. Bed mobility, which is basically sitting up in bed and getting out of bed, something like that. Patient 1 had a minimum assistance, which is basically he was doing 75% of the work while the therapist was doing 25% of the work. While patient 2 had moderate assistance, which was basically 50-50. For transfer, that's basically getting out of bed and moving to a different chair or walking. Patient 1 had minimum assistance with a standard walker, while patient 2 had moderate assistance with a standard walker, and she had difficulty with the walker even. This is a chart comparing the final evaluation before discharge. A gait analysis is basically walking analysis. So patient 1 walked about 100 feet with a standard walker and only with supervision, while patient 2 walked about 50 feet and they still had minimal assistance from the therapist. For safety, the physical therapist decided that it was safe for the hospital discharge for patient 1, as long as he had a family or a caregiver there to assist him while he was at home. Patient 2 was a high fall risk, and she didn't have a lot of safety awareness, and she needed assistance for out-of-bed mobility. So as a result, the recommended level of care for her, patient 2, was a further inpatient therapy program at SNF, which is the skilled nursing facility. It's an Ochsner facility in Elmwood. And patient 1 was recommended for home health. So patient 1 was discharged home, while patient 2 was discharged to SNF. Patient 1 was discharged home within 4 days, while patient 2 was discharged to SNF in 5 days. Therapists set goals for each patient before their surgery, before, when they start after their first evaluation. So patient 1 met 4 out of 5 of their therapist goals, while patient two didn't meet any of their 4 goals. Like I said, patient 1 had minimal assistance and patient 2 had moderate assistance. And patient 1 was able to maintain maximum challenges asked of them, and patient 2 was only able to maintain minimum challenges. I started out with my project. This wasn't my first project title. My first one was what is the effect of early mobilization on recovery time after total knee replacement surgery. But I couldn't go through this because of a lack of data. It's immoral to not work on a patient, which would be late mobilization, which would be uncontrolled. So it's immoral to not work on that patient early because they know it's a known fact that if you work early, there'll be better results. So this is my product. It's basically just a pamphlet explaining to family members of patients who have had some kind of surgery and they're immobile. It describes to them proper body mechanics so they don't get hurt while trying to transfer their family member.